Have a good day, ma'am. My report is all about the infections occur in our respiratory system. So these are the respiratory tract infections, and this is divided into two, which is the upper respiratory tract infections and the lower respiratory tract infections. In the upper respiratory tract infections, the most common infections include the sinusitis, the otitis media or the middle ear infections, and the pharyngitis. But we have to focus only in one infection, which is the otitis media or the middle ear infections. But before that, I want to show the difference of the normal middle ear and the infected middle ear. So as we can see po sa ating picture sa left side, yung normal middle ear, na kung saan clear po siya or wala pong makikitang anumang infected area po doon. And then, yung function po ng ating middle ear is to transmit vibration from the tympanic membrane to our inner ear via auditory ossicles. And then, sa ating next picture naman, sa ating right side, yun po, nakikita po natin yung picture ng infected middle ear. Nakikita po natin na may pagbabara po sa ating middle ear o sa ating ear canal. So, yun po yung pagkakaiba ng ating normal middle ear at saka yung infected middle ear. So, what is otitis media nga ba? So, from the name, we can already know that it is something to do with the inflammation because of its suffix itis, and whenever we see media, we can think about ear. So otitis media or acute otitis media is the inflammation of our middle ear, and it follows right after a respiratory infection. So how does it happen? So our auditory tube connects the nasal pharynx of the throat to the middle ear pathogens, and the upper respiratory system travels to the middle ear through the pharyngotympanic tube, and this causes inflammation, occur, fluid, and pus, and it will build up to the middle ear being inflamed. Then pressure from the fluid and pus will cause the tympanic membrane, also known as eardrum, to bulge into the external auditory canal, and this is what causes pain and the trouble hearing. So, bakit po mas common ang otitis media sa mga bata? It is because children have a shorter pharyngotympanic tube na kung saan it makes the pathogens of the respiratory system to easy enter the middle ear. And then, children also have a less developed immune system, which makes easy for them to catch an infection. So what are the symptoms of acute otitis media? So first is ear pain, trouble hearing, fever, irritability, and vomiting. So the treatment of some doctor may wait to see if the infection clear up on its own, and they'll give it about 2 weeks. But if not, the patient may be prescribed penicillin antibiotic called amoxicillin. So that is all about otitis media, which is the infections in our middle ear and one of the infections also in our respiratory system.